All right.
All right.
Great. Hello. All right. Hello, everyone. Welcome today to our presentation on Magellan Health. My name is Joshua Fryman.
My name's Abby Hansen.
Caitlin Starring.
I'm Darren Latour.
Alejandro Pinto.
I'm April Williams.
All right, guys. So here's our introduction. We're going to do a financial overview of Magellan Health, and we're really going to look at what is their business and fiscal health. What's their fiscal state looking like? We need to know, is Magellan Health a good financial investment? Is it a proper fit for our portfolio? Is it a really good? What's their future actually looking like around here? Are they on the upswing? Are they on the downswing? Where are they at really, according to their own numbers that they're putting out publicly? Let's continue. All right. So a brief description of the organization. They were founded in 1969 in the state of Delaware, and Magellan Health provides services to health plans and other managed care companies. There are other managed care organizations, employers, labor unions, various military and government agencies, and third-party administrators. They do business predominantly in the New England area, around the geographical region, Pennsylvania, Delaware, New York. They love that region. That is their main region where they work. That's where most of their customers are that aren't the federal government. And they mainly operate as a provider of managed healthcare and both the clinical and financial management of pharmaceuticals. Very important. They're a managed care organization, so they don't actually deliver the care themselves. They have third-party agents who deliver the care. So their business is dividing into three total segments: the healthcare, the pharmacy, and everything else that's corporate. The healthcare umbrella includes their behavior and specialty care and the Magellan Complete Care, which is, again, carried out by third-party providers. Magellan Health itself does not actually dispense the healthcare that is being managed. Then there's the pharmacy, which is the clinical. There's their pharmacy sector, which is the clinical and financial management of pharmaceuticals that are paid both under medical and pharmacy benefit. This includes federally backed health plans like Medicare and Medicaid. And finally, there's the corporate, which is really just an umbrella for everything that is not under the healthcare or pharmacy umbrella. It is mostly related to the cost of being a publicly traded company. All right. The CEO at this current juncture at the time in 2019 is Kenneth J. Fasola. He graduated from Penn State University in 1977, attended in 1977, graduated in 1981. He has a BS in health planning and administration, and he served as the president and CEO of Health Markets Incorporated. Used to be one of the largest insurance agencies in the U.S., so he definitely has experience. He's responsible for Humana's major medical specialty and supplemental insurance operations. He was the CEO for Secure Horizons, a division of the United Health Group and one of the nation's largest Medicare Advantage insurers, and CEO of United Healthcare's Central Region as National Sales Officer and President of United Healthcare Alliance of Business. He's clearly an experienced leader, and his wisdom, as you're going to see throughout this presentation, his leadership skills are carrying through from Magellan Health's financial state. I think you'll be pleased to see what you find. Next slide. All right. The board members here, I'm not going to read off every name on the list. If you like, you can pause this presentation so you can look at and look up every single one of these names. But these are the total members of the board right here. All very wonderful people.
So in the last slide, we saw all the board members, and some of them had a little description after them. But on this slide, I talk explicitly about the directors and give you a little bit more information about them. Like Joshua said, if you want to pause and get more information about them, you are more than welcome to do so. So there are a couple different divisions and services offered by Magellan Health. They do healthcare benefit management, behavioral health management, and healthcare consulting and supporting services. The behavioral health management focuses a lot on mental health and substance abuse disorders in which through their third parties, they offer therapy, counseling, and treatment and stuff to help people get through these times. In their benefits management, they help with managing healthcare benefits efficiently. Sorry. Some of those examples include managed care solutions or telehealth services. They assist with those and they help clients, so the people that work with them, optimize their healthcare benefits, their control costs, and improve access to quality of care. In their consulting and supporting services, they consult for healthcare organizations, employers, and government agencies. They also have wellness programs that promote overall health and well-being, as well as care coordination and case management to help people navigate the healthcare system. And then final statement overall is to help individuals live healthy, vibrant lives. But I also did find this image that I thought was a little more specific for Magellan Healthcare and Magellan Federal, which was building thriving lives, resilient minds, and healthy bodies, as well as absolute commitment to serving those who serve our community.
Now, when it comes to expansion activities, a lot of the things that we're going to discuss are in the acquisition section, which will be later on. However, Magellan plans to expand geographically with its footprint in existing states and other states as well, and targeting new geographies for managed Medicaid opportunities as well. Also plans to service expansion in their existing contracts by increasing retention and adding new members through local market strategies and by upselling newly developed services to existing customers. The company also plans to focus on the specialty drug management section of their market by leveraging industry leadership in specialty drug management and implementing value-based strategies for cost control. Finally, they plan to focus on strategic partnerships as well to form joint ventures and partnerships to enter those new markets and combine overall expertise to enhance those services that are offered. Now, when it comes to social responsibilities, we couldn't find anything specific in the annual reports, but the company does focus on compliance and ethics, which it does mention by adhering to SEC regulations and various healthcare laws, also ethical business practices, and focusing on reporting everything accurately. The company also focuses on protecting sensitive patient and client data in accordance with HIPAA. Also, for social responsibilities, the company focuses on healthcare quality by providing high standard healthcare and pharmacy management services, and looking at the employee relations by promoting fair labor practices for a safe and inclusive workplace. Magellan also will look at environmental impacts by implementing sustainable practices and reducing their carbon footprint throughout the organization. They also look into community involvement by enhancing public health throughout the community programs and looking at partnerships through that. And then with market conduct as well by ensuring fair market activities and competitive practices and pricing throughout the organization at multiple levels in various locations.
So as Darren put earlier, part of strategic planning is partnerships and acquisitions in this case. So pre-2022, their acquisition by Centene Health, they were mainly located in Phoenix, Arizona, lovely state, little bias. And so that's all of those details with the address. And their lease had expired in March 2024. So looking forward to that, they had a lease change and they were acquired by Centene Health. Now their location is set in St. Louis, Missouri. So as a total business strategy, I mean, these are kind of their four main components that they ride and die on. And then the next slide will kind of go over sources of revenue and sources of risk that they are able to collect based on this business strategy and adhering to their vision and mission. So the company's strategy is organized around four main areas. That is to retain customers and drive in new sales. A lot of that, once again, is based on customer relationships and continuously driving the same image, a positive image over and over to their customers. Another is to improve their margins by reducing the cost of care, lowering pharmacy costs of goods sold, and driving operational improvements across the company. We went over how, they kind of go through a lot of third parties. And so a lot of that is, once again, relationships, but also trying to find that balance between reducing the costs and providing efficient resources. And yeah. And then next is maximizing and expanding the company's key value drivers. And last, engaging Magellan's workforce. So as I said, based on those 4 key components, they are able to drive sources of revenue and risk. Their main sources of revenue based on those components are customer contracts, provider networks, competition, and insurance. And based off those, you come across various sources of risk. They operationalize very specifically, and I think based off of that, you're able to kind of target these things to look out for. Those include reliance on customer contracts, integration of companies acquired, changes in the contracting model for Medicaid contracts, expansion of risk-based products, provider agreements, pharmacy management, fluctuation in operations results, and competition. And I put a little side note up on the top of risk-based products. Because the company provides a service at a fixed fee, if they're unable to maintain their margins or is unable to predict, that is also a risk of the company's profitability.
So next, we'll start actually looking at the actual numbers and finances of the company, starting off with the consolidated statements of 2019. It's important to note that these first 4 numbers are shown in thousands. Their net income was $55,902. Their total assets was $3,092,173. Their liabilities was $910,147. Their stockholders' equity was $1,397,783. Their net cash from operating account was $115,800,000. Their investing activities was $16,400,000, which is further broken down to hard assets, which was $15.8 million. Which is like equipment, furniture, and like leaseholds, and then $44.6 million, which was related to capitalized software. Their financing activities was 112. You can go back.
Yep, sorry.
No, you're good. 112,300,000. And that was broken into 59.8 million on debt obligations, 6.2 million for payments on contingent considerations, 4.1 million for the repurchase of treasury stocks, and 7.7 million on finance lease obligation. In addition, the company received 32.7 million from the exercise of stock options and had other net favorable items of 1.8 million. And then finally, their total diluted earnings per share was $2.28. So then next we're going into their acquisitions and divestitures. They had a couple of changes within the last couple years going into 2019, none specifically within 2019. So the notable recent acquisitions, Veridicus and SWH Holdings were both acquired in 2017 for a total of $232.4 million. Like we touched on before, Veridicus is also sort of kind of like the pharmacy benefit management program, while SWH was a privately held healthcare company in the US. At the time of the purchase, it actually provided both Medicare and Medicaid dual eligible benefits to around 22,000 people in Massachusetts and New York. And then they acquired AlphaCare Holding in 2014 and 4D Pharmacy Management System in 2015. No divestitures to report prior to 2019, but drastic changes have occurred, as previously mentioned, with them being acquired by Centene in 2021. So due to that recent acquisition, we're going to focus on Centene stock. I think it's more applicable. So the stock symbol CNC, their previous close was $73.75. Their open was $74.29. Their bid was $74.31. Their ask was $74.98. Their days range was 73.61 to 74.99. The week range was $60.83 all the way up to $81.42. Their volume is 641,304. Their average volume is 3,091,441. Their market cap goes all the way up to 40.019 billion. Their beta is 0.39. The profit earnings ratio is $15.11. Their EPS is $4.95. Their earnings date is April 26, 2024, and their 1-year target estimate is $89.73.
So going off of that, there are a couple different areas that we can analyze within a SWOT analysis. So some of the strengths would include that their reputation, despite being acquired, they've been an established organization and have credible services and quality that has been provided, as well as they offer a unique service line and have those diverse offerings with behavioral health, pharmacy, and specialty care. On the flip side, there are some weaknesses. So for one, geographic limitations. While they're expansive, they still focus on local markets, as well as the government contracting. They rely on government contracting a lot for their funding, which may have implications. So it'd be considered a weakness. As well as there are some opportunities. So for one, implementing adaptive ideas such as telehealth to be able to reach more patients outside of their current footprint, as well as they have a fixed fee schedule. So an opportunity there would be to transition to more values-based care and be more collaborative with their clinical staff and document those improved quality outcomes. And then threats, so in healthcare, regulatory changes, making sure that they are remaining in compliance and keeping up with industry changes and adapting to those regulatory changes, as well as competition, making sure that they are analyzing their competition in the surrounding areas. Some of them to name is St. Luke's Behavioral Health, Valley Care, and Arizona Behavioral. And then on the next slide, so going off of the previous couple of slides, so there are quite a few factors to consider when we analyze the outlook of the organization. One being those industry trends with technology, service lines, and values-based care, as well as those regulatory and government changes and the competitive landscape. So in looking backward at 2019 and then assuming that the organization would adapt to all of these aforementioned, which now thinking ahead with them being acquired by Centene Health, we can take a look financially with the outcome and see that there is an upward trend. But at that time, Magellan Health was reported to have a growth score of B, and then the momentum was higher with an A. So in looking at this for even Centene Health, it did make sense to acquire this as an organization. And then based on their stock information, which was just reviewed, they are still on an upward trend. So lastly, to kind of pull everything together as a conclusion, so based on the information that was analyzed for 2019, the organization is in a stable state. Again, they've been acquired by Centene Health, but they did have the opportunities for growth and adaptation to some different trends. The organization also displayed that they held more assets than liabilities. And lastly, that their leadership is really displaying that alignment between their mission and business strategy, which contributes to maintaining a stable outlook for the organization and driving the organization to an upward trend in success. So.
And here are all references used for this presentation. Thank you so much and have a great day. All right, let me